Hello, and thank you so much for tuning into the program. I'm your host, Neal Howard, here on Health Professional Radio. Our guest is Dr. Bob Carter. He's the Department of Neurosurgery Chief at Massachusetts General Hospital. He's joining us to discuss what's coming down the pike in neurosurgery, brain cancer treatment, and he's also going to discuss some groundbreaking research as well. Welcome to the program, Dr. Carter. How are you?
Great. Thank you, Neil. Happy to be here.
All right. Talk a little bit about your experience and a bit about your training background in the field of neurosurgery.
Oh, that's great. No, I'm happy to do that. So, I started in medical school back at Johns Hopkins in the mid-'80s. And at the time, sought to get additional training with a PhD. And right around that era, the interesting aspects of tumor genetics were coming out. And so my PhD work really focused on prostate cancer genetics, interestingly. But as I got to near the end of medical school, I did a rotation in neurosurgery and essentially found my medical true love at that time. But I've been focused on brain tumors since then and have continued to develop a career over the last 2.5 decades.
So what was it specifically about neurosurgery that drew you in?
Yeah, that's a great question. So the chief of my department at the time, Dr. Donlin Long, I remember very specifically on a certain day, I did a very interesting tumor at the base of the skull of a patient and removed it. And there was a beautiful dissection that occurred, and the anatomy was just incredible to see how delicately the human nervous system was constructed. And then to see us and work his way through that to try to really help this patient was very inspiring to me.
Were you initially involved in treatments and surgery before being involved in research, or is this something that kind of went hand in hand shortly after your residency or thereafter in your career?
Oh, no, that's a great question as well. One of the things that we've tried to emphasize here at Massachusetts General Hospital is the development and training of surgeon scientists. Some of the fundamentals of surgery have been the same for almost 100 years, but we think that we can change the way surgery is done and also help the right patients with surgery through our research.
So let's talk about some of these new developments that are coming down as far as brain research, brain cancer treatments and whatnot. What are you most excited about as far as your area of expertise?
Sure. One of the things that we're excited about is the new molecular classification of brain tumors. It used to be the case that a pathologist would look at a brain tumor under a microscope and tell us what they thought it was, and we would try to direct our treatment based on that information from the pathologist. But now we have new ways of analyzing the tumor, and you've probably heard about the great advances in genetic sequencing. And so these days we can actually sequence the tumor in a relatively short order following the procedure, analyze the various genetic changes. And this has given us a new classification and actually new therapies that are directed specifically at given mutations. And that's a powerful concept for us.
Have you looked into anything or come across any developments as far as determining what is the best course of action genetically based on the patient's genetics?
Great question. So we have identified, we and many others have identified an important signature of brain tumors is called the IDH1 mutation, isocitrate dehydrogenase type 1. And this particular mutation, fortunately for patients, portends a much more favorable prognosis. And we know that in those patients that have this specific mutation, they differentially benefit from our surgery. That is to say, if we're able to remove the whole tumor or all that we can see visually, those patients have a much greater benefit than the patients that do not harbor that mutation. So one of the things we're working for, Neil, is to try to diagnose that mutation earlier in the process, either through a biopsy or even a liquid biopsy, a blood test, essentially.
You were talking about the intricacies of the anatomy. Do you see any room for robotic surgery as far as dealing with brain tumors, brain cancers, and other areas of neurosurgery?
Yeah, great question. In some ways, much of neurosurgery, even of the last 2 decades, has had a robotic component. And what I mean by that is a computer-guided component. Increasingly, we are now using visualization devices and holders and instruments that are on mechanical arms. While the classic robotics have not yet penetrated into brain surgery, we're on the cusp of that. But computers and computer guidance and visualization has really revolutionized what we do in the last 2 decades. I'll mention one little thing to you, which is at this point in time for a patient that we're operating on, we have millimeter accuracy within the entire 3-dimensional scope of the brain. So prior to surgery, I know within a millimeter exactly where the tumor is. And then at centers like ours, where we have intraoperative MRI, we can actually confirm that right in the middle of the operation. So we can pause the operation, take an MRI scan, and then with that new information, gauging any additional shifts or slight alterations in the brain anatomy, we can, again, target our therapies more specifically.
How do you relate to your patients when you're trying to explain to them some of these new innovations that are going to be used in their particular treatment? What type of challenges do you encounter when trying to make patients understand the efficiency and the risks involved? Yeah,
that's a great question. As I mentioned previously, that IDH1 mutation is a good example. So if I have a patient whom I know has an IDH1 mutation, I may want to push the boundaries of my resection to try to get to 90%, 95%, or even 100% of the tumor removal. But as you come up to the edge of the tumor, there is often normal tissue right adjacent. So if that normal tissue happens to be near the motor cortex, which controls the movement on the opposite side of the body, or if it happens to be near the speech area, now that patient has a choice, in essence, or with their surgeon, there's a choice. Do I go for that little bit of extra resection, but recognize that the complication rate might go up a little bit as I get closer? So one of the things that we do, Neal, is we have a variety of intraoperative adjuncts. So we have neurologists and physiologists that attend with us in the operating room. And as we get closer and closer to those areas, we have ways to monitor that functionality while we're working. And occasionally that means having the patient awake during the surgery. And we're actually inquiring of them and testing them during the procedure so that we can be assured of that safety margin that we need. And I think patients are a little nervous when they hear that they might be awake during brain surgery. But fortunately, the vast majority of patients tolerate that really well, and they do. It's actually always amazing to me how well they do during those procedures.
What do you think it is that sets the Department of Neurosurgery at Mass General apart from some of the other institutions? Yeah,
great question. I think it's really the infusion of constant new energy and research. We take in about $110 million a year in research funding from the National Institutes of Health to drive new therapies for essentially brain disease, and brain tumors is a significant part of that. We have one of the nation's largest centers of neuro-oncology, so we have 11 neuro-oncologists and over 6 neurosurgeons who are only focused on brain tumor work. And that's pretty unique in the United States.
Well, it's been a pleasure. Lots of great information. Thanks for taking the time and coming in and speaking with us today. Bob, it's been a pleasure.
Thank you, Neal. Happy to be here.
You've been listening to Health Professional Radio. I'm your host, Neal Howard, in studio with Dr. Bob Carter, Department of Neurosurgery Chief at Mass General. Transcripts and audio of the program are available at healthprofessionalradio.com.au and also at hpr.fm. Subscribe to this podcast on iTunes. Listen in and download at SoundCloud, and be sure and visit our affiliates page at hpr.fm and healthprofessionalradio.com.au.